Welcome to this meeting of the Healthier Communities and Older People's Overview and Scrutiny panel. Item 1 is apologies for absence. Do we have any apologies for absence?
Chair, we have apologies from Mr. Salim Sheikh.
Okay, any others? Right, okay. Item 2 is declarations of pecuniary interest. Are there any declarations? No, you're doing very well. Item 3 is the minutes of the previous meeting. Are they approved? Just nod. Right, that's it. Item 4 is the budget and business plan, but I have received a request from the Director of Public Health, who, as some of you may know, has been somewhat busy over the last few months. And she has asked if she could be moved up the order of the agenda. I think that's a reasonable request, but I'd like to see your approval of that before we proceed. So nods will be sufficient. Okay. In that case, Dagmar, can I ask you to provide us with your report, which was originally agenda item 5, which is the impact of COVID-19 in Merton. Do bear in mind that we have a very substantial item in terms of the budget on the agenda. So I'm asking you to, it's really important that we know what's going on, but it's also important that we discuss next year's budget. So if you can bear that in mind and give plenty of time for people to ask questions. Dagmar, the floor is yours.
All right, many thanks. And good evening, everybody, and many thanks for being so accommodating. So you will get the slides, and I will just give you a brief overview over the data, and then
we've lost you.
Leaving lots of time. So if we straight move on to the next slide. And the next one. So these are the summary key messages. You will now be familiar. And the basic unfortunate drama in the wrong direction. So infection rates are still very high. Test positivity, we are measuring also as indicator, very high. So if you simply look at the numbers we are dealing with now, it's about 300 cases a day. And obviously, what we are particularly worried about is harm. And you can see that we had 13 new deaths in the last period we measured. So unfortunately, this is now the consequence. If we move on. These are just slides for you to have a look at, because we compare ourselves obviously with elsewhere, and you can see with the colorful slides, the worst are the purple, I call that the bruises, and Merton is in there with infection rates right just below 1,000 per 100,000 over a week. If we move on. This again, I won't dwell. It shows us how much we've increased over time. So that gives you an indication of the steepness of the rise of the pandemic, if you move us on. And this is an important slide because it shows us the impact on the NHS. You see total hospital admissions, admissions to inpatient and ITU units. And then I wanted to draw particular attention to the two lower ones. On the left-hand side, you look at total bed occupancy. As the NHS is really under pressure, and Southwest London is not an exception. And then on the right-hand side, you see the severity of the impact. So it's people needing oxygen or ventilation. So it is, as one of our NHS colleagues recently said, grim. If you move on. So a little bit of local analysis. So very important, we've worked hard. We've got our testing centres up in Merton, and they used to not be particularly well used. If you look right at the left-hand side, sort of hovering around 20%. And then they were actually over capacity. So DHSC had mobilized longer opening hours and extra slots for the anticipated spike before Christmas, and they are now just working within capacity. So that is good news. If we move on. We always keep an eye on east west distribution. You can see at the beginning of this graph, there were often crossings. Sometimes the west was leading, sometimes the east was leading. We've got a little bit more of a split now, a persistent split with more infections in the east. But again, there are fluctuations in the system, so we keep a close eye where that is going. If you give me the next slide. This is one that looks again pretty dramatic. The darker the color, the more cases there are. And as you can see in terms of age pattern, when I spoke to you last, we had a particular increase in cases around the youngsters, the 16 to 29. You can see on that slide, the beginning of December, that was still the case, but now it's pretty black everywhere. So only even the really little ones have caught up, and obviously most worrying for us, the over 60s, because the risk is so high. If you move us on. And this is an important slide as well. We continue to keep a good eye on the ethnicity of our positive cases. And then on the right-hand side, you can see we compare it with the general distribution of our ethnic minorities. Unfortunately, in the last week we have data for, we had a lot of non-recorded, 14%. So that it makes it more difficult to draw conclusions. But obviously, sort of tackling the disparity of the pandemic is a big priority. And so it's important for us to monitor where the impact lies. If you move us on. And this gives you an overview of outbreaks. Our biggest problem now are care homes, unfortunately. You will be aware the new variant is much more transmissible. So what we observe is once it creeps into a care home, we have got pretty explosive outbreaks, and we do intensive audits, and the infection and prevention and control is pretty watertight. So there is something clearly going on in terms of more transmissible. The good news is that we're doing a lot of testing, and you see that the majority of our positive cases in care homes are asymptomatic. So in terms of harm, that is different to the first wave. If you move us on. And this is a familiar slide now with our deaths. And as I said, again, we monitor closely. And unfortunately, over the last period, we had 13. That is by far the highest in this wave. But in comparison, again, to April, you see the different shapes of the curves. Luckily, that is not as high as in April. If you move us on. So that was just a canter through. What I suggest, Chair, but obviously take your steer. I will give you a quick overview of our asymptomatic testing, and then we wrap up the questions into one. Does that make sense, Peter? Is that all right? Yeah. So a lot has been talked about the asymptomatic testing, and unfortunately quite a lot of misunderstandings around. So I thought I'd spend a very quick moment to explain. It's very critical to understand why do we want to test asymptomatic people. The main thing is what we call test to find, because we want to find the positives. The assumption is that 30 to 40% of all COVID cases are actually asymptomatic. If we find them, finding on its own obviously is not enough. They need to self-isolate to break the transmission. There's also tests to enable. You will have come across this. This is a slightly different purpose where we want to confirm negative individuals so that they can do something that they're normally not able to do. So visiting in a care home, or if they have to self-isolate because they're a close contact, if they test 7 days in a row negative, each day they will be enabled to, for example, go back and teach in a school. So that is a purpose that is still only being piloted. So it's quite important. But obviously, for the future, when we want to open up society again, an important purpose. 2 tests are out there for asymptomatic testing. The gold standard is the PCR. You will have heard it. It's normally used for symptomatic testing, but in some high-risk settings like care homes, also for asymptomatic testing. But the one we are concentrating on now is the lateral flow test. That one is lower in accuracy, but it's point of care, so it doesn't need a laboratory. You do it there and then. And obviously, we're all waiting that you can use the lateral flow at home as well. It's a bit fiddly. It's like a pregnancy test, but a bit more complicated. And so we're waiting for the final approval. The in-principle approval has already been given. So that, just hold on to those. If we move on. So what are we doing in Merton? As overview is there are 2 types. One is that we target our asymptomatic testing to frontline staff, because we're obviously all in lockdown, but some staff, and really quite heroic, I think, are keeping us all going, be they in shops, in health and care, drivers, transport, etc. And those are obviously exposed. So the purpose there is to test them regularly, once or twice a week. There's also, and it's driven by the Department of Health, mainly the opportunity for every resident, if they so wish, to have a one-off lateral flow test. And so there are 4 arms to our program. First of all, we very much support national testing with LFTs, because you will have known and seen that there are programs that are run nationally, for example, in care homes and in secondary schools. Then we have got a program of local community pharmacists, and I'll give you a few more details in a next slide in a minute. Then what we're doing is we are devolving LFT staff testing to various teams within the council, as well as to main partner organizations like police and fire. And then we've got a site where you can go and be tested. Well, you do your test yourself, but you're supervised, and that is Morden Assembly Hall. So if you give me the next slide. So first of all, the community pharmacy service, really important. We're targeting it particularly at the voluntary sector, volunteers, carers. At the moment, 10 pharmacies have already signed up and more in the pipeline. There was some discussion around East-West split. We had more in the West, but we've got a Mitcham one now. And really important that there are 2 types. There is the standard option where the individual just does the swabbing and leaves, but there's an enhanced option, and that offers really a lot of added benefit where there is some health protection, promotion and general advice. So there's also for you to use as reference how you can book. If you move on. That is the devolved testing. So we're mainly targeting teams in the council, so adult social care, and then partner organizations, so police and fire, primary schools, early years. And the main thing there is that the organizations run the testing program themselves. We provide the oversight, their standard operating procedures, guidelines, training, and we are brokering the supply of the tests. We get them delivered from the Department of Health. So that's the devolved model. If you move us on. And then Modern Assembly Hall, as you're aware, that's our site-based testing, and it has a double purpose. So it is the site where it's open to any resident who wants a one-off test, and then anybody, any staff group that cannot or doesn't want to have a devolved program because they might be too small, they can go directly to the Modern Assembly Hall. And just be aware, I think it was a heroic effort. It was launched just after Christmas. It's run by volunteers. And at the moment, we started off small in order to get it all going, around 100, 150 tests a day. I think the slots are opening up, and the maximum that we think we can do is 800 a day. And again, for you as reference, there's the booking, if you move me on. So I think I won't go through the restrictions and the major incident that the mayor has called. I just wanted to add it into the pack for you as a reference. That's me done.
Thank you, Dagmar. Are there any questions for the Director of Public Health? No? Okay. Well, in that case, can I say thank you to Dagmar for that presentation. That's given us a very clear idea of what's happening, and some worrying news in there, but and also you've provided us with a good understanding of the plans in terms of testing, and so thank you very much. And I guess you can get back to fighting COVID-19, and we wish you well. We'd like to say, as I have done on previous occasions, a huge thank you to you and your team for all the hard work that you are undertaking on behalf of the community of Merton. Thank you.
Thank you very much.
Okay, well, that concludes item 5. So we'll go back now to item 4, which is the budget and business plan 2021 to 25. And Caroline Holland is going to introduce this item.
Thank you, Chair. So you've got hopefully the papers for tonight, as well as the information pack that was sent out sort of in between Christmas and New Year, which has some further detail around the equality impact assessments and service plans, as well as the detailed savings. So that's the pack which you should now be bringing with you everywhere, to make sure we get through to the final meetings on Budget Council on the 3rd of March. So you'll recall when I came to you last time round, we had some savings being put forward, which went to the November Cabinet. We have updated the business plan for December Cabinet and shown that the gap of what is still left to be found is still quite significant for us at this stage of the process. 11.7 next year, rising to 12.8 in 22-23 and 13.9 in 23-24. Clearly by now we would have had, as part of that December report, the settlement input and have a much clearer idea of where we're going with savings. Because of the COVID and the delays to the fair funding review and settlement, we got that information very late in the day. So just before Christmas, we had that information. We are still plugging that through, but it is likely with the information that we've got so far that the additional settlement funding that we've got and additional COVID funding for 21-22 is not going to be sufficient to bring that gap down. So we will look to bring forward some further savings to Cabinet on the 18th of January. And they will then come through the next pack. So you can see the information pack has various dates of when they're going to be coming back to you of various times. Just looking at the version I've got, it doesn't quite have all those dates, but you'll see on the front of your papers for tonight, you'll see when the papers will be coming back to you with that further detail for you to consider. So it has been, I think, one of the most confusing times for me to be able to prepare a budget. And I know that must be extremely frustrating for you in being able to scrutinise it. So what you certainly have this time that you didn't have last time are the quality assessments for the proposals which had come forward and gone back to Cabinet to be ratified with the equality assessments. And we've got the service plan information, which will show currently how those services which will be changing or responding to changes and new ways of working as part of the Recovery and Modernisation Programme, as well as the impact of savings on delivery of those particular service areas. So there will be a further update on the 9th of February for this panel on if there's any further savings to come forward and what impact that will have, to feed back into the special scrutiny meeting of the Commission we're going to have on the 17th of February, to feed back to Cabinet then on the 22nd. So we have slotted in some additional meetings for you in order to be able to scrutinise the additional savings that may be coming forward and also the updated business plan. Clearly, we have had confirmation that we are allowed to do a 2% council tax increase and a 3% adult social care precept. So we are looking to build that into the assumptions going forward. But indeed, the 2% council tax increase had already been built in, and the adult social care precept is used exclusively for adult social care. So unfortunately, from my point of view, it doesn't make any difference to the budget gap, but does help Hannah, Richard and John and colleagues within community and housing to deliver some of their services. What we did do before Christmas was actually bring forward those savings which we called non-COVID savings, because we had a gap anyway that we thought we would have, and therefore brought those forward, and also areas where we didn't have sufficient funding. So clearly one of those areas is our dedicated schools grant and the deficit that we've got there, and there will be an update to the January Cabinet on the current deficit, but we are looking at revised action plan and recovery plan to see what can be done to reduce it. But at this moment in time, it is increasing from what we brought to you previously. So I don't want you to get your hopes up about any further releases of monies at this stage. We have had a look at the council tax yield, and you will see from the papers that have been in front of you, we have actually seen for first change in a number of years, a decrease in the council tax base because of the increase in the council tax support scheme and the number of people claiming that benefit. So we are beginning to see a knock-on impact of, whilst furlough scheme is currently being extended to April, there are many of our residents who are currently struggling and increased numbers of council tax support. And indeed, we are aware that there are going to be increased businesses who are struggling with some of the business grants that we are looking to approve may not meet all of the current businesses that we are aware of, particularly people who run businesses from their home, who may employ sort of self-employed staff. So that's an area we have been looking at. But I suppose it's just to flag that in some ways the impact of COVID will be felt a much longer period of time than we thought it would currently be this time in March last year, when we were sort of starting to kick off what we thought would be over in a few weeks or few months. And I think it's clearly very clear now that this will continue, and the impact will continue for far longer than we ever thought it would. Happy to stop there, Chair, and sort of take questions on either the sort of the general budget before we go into some of the details, because you will have discussed some of the savings previously. It would just be the quality assessments which are new for you this time, and if there was anything in the service plans that you wanted to draw any attention to. Thank you, Chair.
Thank you, Caroline. Are there any questions from members? Pauline.
Yes, thank you, Peter. Thank you, Caroline. I have had an inordinate amount of emails from people about the day centre, the proposal to close day centres. And I have contacted Rebecca about this, and she has explained some of what is happening, but perhaps could Caroline explain a bit further?
I think
maybe up to
it
the
was,
contact. Sorry.
I think it may be more appropriate for Hannah to explain that, if that's okay, because it's not a direct full out closure, but I'm sure Hannah can explain how she wants to re-provide those services in light of what we've learned during the pandemic.
Okay.
Hannah, would you like to pick that one up?
Yes, Chair. I'm quite happy to pick it up now, or would you prefer we go through each saving and then I can give you a detailed context of each of the savings, or shall I just take this one now?
Well, the question's been raised. I'm not particularly concerned at what point it's answered, so long as it is answered. You've made a note that that's something that a member has expressed an interest in. So let's do it that way then. When you get to it, we will respond to that and any other questions. Are there any other questions on the general financial position before we start going through the detailed service plans? No?
Nope.
Nigel?
Thank you. I would like to ask some questions about the adult social care grant, and this is for the spending review, and this is worth 2 million. But how can a decision have been made if it's not been taken out from the spending review yet? But therefore it's the local people are having to cover the extra cost. And why hasn't it been announced? Yeah. Thank you.
I suppose, Councillor Member, was it regards to the adult social care precept or adult social care grant? Sorry, I missed.
Yes, it's the adult social care grant, and it is mentioned in the spending review,
Yeah.
which is 2 million, but it's not taken into account. Yeah.
Okay, thank you. So what we had done was attached a spending review briefing that we got from the LGA because it came through too late for us because Cabinet was early December, and we actually got the brief, our settlement date on the 17th of December. So that information will be coming through to Cabinet on the 18th of January. And we will see that there has been some increases in one element of those grants. So if you look on page 76 of the papers, certainly I can assure you that the adult social care grants, including BCF of 4862, that has been confirmed. And there has been an increase in the social care grant from 2776 up to 4.9 million. So that will be coming through in January when we do an update on what the settlement has actually meant for us. But it hasn't been sufficient to close that 11.7 million gap, unfortunately.
Okay. Thank you.
Any other questions? We're still on the sort of the general financial issues and background. Okay, so I can't see any hands up. So in that case, can we ask Hannah to take us through the sort of service proposals?
Okay, thank you, Chair. So if I can start with in your pack, I think it's page 16. This is CH100. It's adult social care and it's direct provision. And I'll just give you a moment to source that. And unfortunately, the way the papers are set up, you're going to have to be prepared to move around a little bit. But what I really just want to urge all members to look at is the draft EIA that sits behind this proposal, which you'll find on page 82. So I think what I'm going to do, Chair, and hopefully answering some of the earlier questions that was raised about this particular saving, is I'm going to set the context, and then I'm going to ask John Morgan to give you some of the background detail in relation to this thinking, because I know it is raising questions for you. So first of all, I'm going to begin start by saying to all of you, this is a proposal. Okay, and we had actually started this work prior to COVID-19. We had started to talk and engage with people in the borough with a learning disability and their carers. When I say people with a learning disability, that is all people with disabilities in the borough, and I know that there is a traditional group of day centre users. So I'm going to talk about those as well, because I know the concern here is about the day centres. So at the moment, we have got 4 day centres. We've got Eastways, which is an older people's provision. We have got JMC, which is our higher end complex needs. We have got All Saints, which is a mixture of service users with both a physical disability and a learning disability. And then, of course, you might be more familiar with our newer updated provision, Leighton Road, and that's a learning disability provision. What we want to do here, and this is the proposal going forward, and we're at the very early stages here, and I just want to remind members that when we looked at this proposal, we worked with our lead member and Caroline Holland and our lead member for finance to think through of when, if any of these savings could be delivered. And you will see from your pack on page 16 that we moved that down the years to give us a chance to do this work. So there is no ready model here, but what is absolutely clear is that we have 4 day centres that's learning disability, physical disability, and older people and day services. But we also have other people transitioning through, our younger people that don't want that traditional model only of community activities. They want to explore further with us access to other community activities and how that could be provided within the Borough of Merton. We've also got some issues around our site. So JMC, for those of you know it, takes very high and complex needs, but the building isn't fit for purpose. So we're very, very keen to look at the options around developing that high-end state-of-the-art building for people with very, very complex needs that require daycare services. But what we have seen prior to COVID, and certainly during COVID, is dwindling numbers. So we are running 4 buildings with lots of costs involved, and our numbers are dropping. And that's not about referrals. That's not about people not being able to refer. Referrals are based on individual assessments as per the Care Act. Now, we've particularly seen this in Eastways. And during COVID, we had to close Eastways. That wasn't because of this proposal. It was about safety. It was about vulnerability and keeping those people that attend daycare safe. But prior to COVID, they were coming for very short periods of time, sometimes not even able to complete a full day, because the majority of older people that come in contact with adult social care want to do different things. They want to go to their lunch clubs. They want to go to their libraries, all those different community activities. So again, it's this range of options that's available. I want to remind members that, again, as a proposal, even with COVID, even in wave 1, we were absolutely determined to continue the provision. And we worked tirelessly with our Director of Public Health and her team to make sure we could do that safely. So we kept JMC open. And the reason we kept it open was we knew those carers would need that level of support. We knew service users would need that daily interaction. So we transported people, even in wave 1, into a safe environment. And thankfully, with infection control, we managed to keep people safe. And we have continued to do that right through the summer and right through wave 2 and this new lockdown. The same with Leighton Road. We were able to open up Leighton Road in a safe way to get as many people in. But there was people who chose not to come, and that was for some good reasons. Some were shielding, some were clinically vulnerable, and some carers didn't want to have that level of contact within those environments. So various reasons behind that. What we did learn during that time, we had paused on the work that we had done because our work was responding to that critical situation of the pandemic. But what we learned very quickly was different ways of outreaching and making sure that people with learning disabilities, people with physical disabilities, and older people that had been attending the centres had that level of outreach and interaction. And I think direct provision staff did some amazing things, from, you know, when the weather was good, to walks in the park, and to different online Zoom calls and different ways of making sure people had access, people had both that mental and emotional and well-being support. This isn't, again, I'm very clear about this, this isn't about closing day centres. This is about looking and consolidating and thinking through what we've got at the moment, what can we do better, and looking at how many centres we actually need to operate. There is always going to be a group of residents with either a learning disability or a physical disability in Merton that like the traditional model of daycare. And that traditional model is building based. They like to come to a building like Leighton Road, a building where they can interact with others. But we have to think about the other options for our younger people coming through, and the options that some of those sites can help us think through about the future. And when we move on to the next saving, we'll cover a little bit of that. Even though they're separate, it's about those opportunities for accommodation. So I think we do have a great aspiration here, and that's about ensuring everyone with a learning disability in Merton has access to community activities. Some of that may be a traditional day centre, but I think there's a couple of other social detriments that's really important, and that's access to quality supported accommodation. We send a lot of our people with learning disabilities that require that support, we send them out of borough. So we need to think through what the consolidation of those sites could mean for us, working in partnership with the voluntary sector, with the independent sector, and where the expertise is in that type of accommodation. Another key aspect for us is access to education and access to employment opportunities. And that's been a real challenge in Merton, and I don't think Merton is alone in that. It's going to be even more of a challenge as we move through this pandemic. So I just wanted to set that context really, and to offer that reassurance that this is a proposal. We're not in any way near consultation. We need to continue the engagement. We need to continue the talking. I'd like people with learning disabilities, and I can tell you our younger people coming through want to design this with us. They don't want us to have a ready-made model in the back room, and that is a promise that we will work with them to ensure that we get that model of going forward. So that's just the background to it. This isn't something new. It's been something we've been working on for pre-COVID. So I'm going to stop there, and I'm just going to ask John, Chair, if that's okay, just to fill in a little bit of the detail, and then we can open that one up to questions, if that would work, Chair. Thank you.
Well, as Hannah has said, we'd started a lot of this work prior to the pandemic. So we'd started a lot of engagement with our younger cohort of people, kids first, adults first, and with our current service users within day opportunities. And they had told us all the same thing as Hannah said. The younger people did not want to go to day centres moving forward. They wanted a bigger range of things. We also started looking at the model, and we saw ourselves, our model is a very traditional model. Our day centres are open from 10 till 4. People are shipped in buses to the day centres. And one of the Kids First members, it's a big group, there's over 800 members of Kids First and Adults First, told me last week that actually, John, your day centres are open between 11 and 2 o'clock, because the other hours before and the hours after are buses driving people across the borough. in that model that we have is Monday to Friday. So after 4 o'clock at night, we don't have much else. At the weekends, we don't have much else to offer except for the day centres. So we knew the numbers are going down, less people want to go to day centres. The model itself is very traditional, and our engagement told us young people didn't want to go. Older people currently in the service, while lots of them love the service, they want other options. They want more things to do. As Hannah has said, during the pandemic, we started to do things very differently. So we left one of the day centres open for a very limited number of people. And then when we could, we opened again one of the other day centres for a limited number of people to help us maintain social distancing. But to meet the needs of those people that we couldn't get to come to day centres, we started to do things very differently with a much more outreach model. So we utilised our staff to do things with groups. Very socially distant, very difficult time, of course. We couldn't do the kind of all the things we wanted to do, but we had our staff doing things with people at different times, in different ways, and in smaller groups, doing the things that they wanted to do. That is the model that we sort of want to build moving forward. It's important again to say, Hannah's already said it, some people love day centres. This proposal is not to have no day centres. It is to have day centres, but with other things on top of that, the things that our residents actually want to do. That was all I wanted to add to what Hannah had already said.
Thank you, John. Are there any questions? Linda.
Thanks. I'd just like to start off by saying, Hannah, I have complete faith in what you're trying to do. You know, you have a good heart, and so I don't have any problem with that. What I have a problem with, and I don't have a problem with a review, and I think a review is essential. I remember when we did a review when I was cabinet member in adult social care about adult centres, and there was definitely a trend. People wanted to have more activities outside of centres. We didn't want to sit down. I certainly wouldn't want to be playing bingo if I was in one of them. But I'm just saying that, you know, we went through a big review then. It was very clear that people's attitudes had changed. And I don't have a problem with a review at all. And if the review brings about a better service, absolutely no problem. My concern is that there's a figure against this. This is not a review. This is a budget-led review now. So it's changed its structure altogether. And if we were not talking about budget-led, I think, you know, there would be no problem. But we are. There's a figure in there. And I tried to work it out. I was a bit confused, really, because you put adult in with the learning disability service. And so therefore, I wasn't sure whether that figure, the whole service was learning disability or whether it was adult older people's. But I worked it out, it was about 15% of the budget. Now, 15% of the budget is a massive cut. And quite frankly, if we end up with a better service from a review because of the review, I don't have a problem with that. But if we've got hanging over our head that we're making a 15% cut to learning disability services, I think we do have a big problem with that, because there's pressure then to bring that about. I have a concern about why we're going outside to consultants, why we couldn't be doing this in-house, why we couldn't be in consultation with MenCap, because I think MenCap will, I mean, I don't know who the consultants are that you're employing, but you know, for me, you want people who understand the service users so that you really understand what problems that they're encountering, and there's real empathy there, and I'm very bothered about that. But I also feel concerned that, you know, my impression is, and I may be wrong on this, is that, you know, it took a bit of doing to get consultation going. I know you've been through a COVID period, but I know that people are very anxious about this, because we're dealing with a vulnerable group here who, you know, and it's not like ordinary people who've got a problem. It's not just the service users that we're dealing with here, it's carers as well. It's a double problem for us. And so the level of anxiety that's out there already around this, with the figure in the budget, is high. You know, they are already supporting their judges at home. They're probably doing other work as well, which is a big issue. And at the same time, they're going to be asking to take part in an exercise, which could be good, but it's got a budget figure over the head of it. It's scary stuff. And that's my problem. I am very worried that this is a 15% cut in the learning disability budget. I'm very anxious about it. I was involved in setting up what was then a state-of-the-art learning disability service right the way through the budget. It was differentiated back in 1990, and I know things have changed for a lot of people, but actually for many people it hasn't changed a lot at all. The other factor I would say here is that there are a lot of young people who do want to see different things, but there are also a lot of young people coming through with complex needs who will need that level of support, and their carers will want respite. So, you know, let's not throw the baby out with the bathwater. You know, I'm really worried about it, really worried.
Thank you, Linda. Could we just ask Caroline to, sorry, I've got you, Jennifer, I've seen your hand. We'll come back to you, but Linda's just mentioned this figure of 15%. Caroline, could you respond to that, please?
So I think, and Richard may have some further information on this, but I suppose of the overall learning disability budget, it's not 15%. I'm just wondering if Richard, I'm just trying to find the information, if you've got that to hand.
Yeah, if I may, Chair. Yeah. Just to be clear, I mean, the budget that's shown in the sheet only relates to direct provision. The 700,000 proposed saving is against all daycare, not just learning disability. What proportion might affect which user group is not determined. We'll go work through that process and through the consultation. But just to be clear, we spend in excess of £20 million in supporting people with learning disabilities overall, if you include what we directly provide and the amount of care that we buy in and the staffing that we pay for. So it's actually a much smaller proportion. Even if it was the full 700,000 was all LD, which is unlikely, it would be around 5%. No, nothing like 15%.
Thank you, Richard.
Be good to know what the actual figure is, though, please.
Well, I think that's
not today, but
no, but we will certainly ask officers to calculate that figure and circulate that information to all members of the panel. Hannah, do you want to speak specifically on this?
Yes. First of all, can I thank Councillor Kirby for the questions that she raised, all very important. I just want to come back. We certainly will go away and provide that and break that down. But I think I'm bringing us back again that this is a proposal. So it's not that we've allocated 700, that this bit goes to LD and this bit, but we will work through some of our thinking with you and share that with you in terms of coming to that figure. And can I just say, Councillor Kirby, I appreciate this. This is always the difficult bit of budget setting, because you're absolutely right. This piece of work is needed. There is no doubt about that. We have got to look at the wider need, and it's not just about day activities. You've said yourself in your comments, which I really appreciate, that need around the complex needs cases, that we do need the JMCs of this world, but we need a building that we can do more in to provide a better service. So I take that point, and we're nowhere near consultation. I just want to really be clear on that. We are at the very start of engagement on this. And in relation to working with MenCap and all of our organisations across Merton, including our Learning Disability Forum, including Kids First and Adults First, that is absolutely critical to us. MenCap is a big part of this work. And if I may, Chair, because I think it's quite an important point that Councillor Kirby raised, was the bit around the external consultants. And I want to be absolutely clear of what the scope of that work is. So I'm actually going to bring Phil Howlin to just very briefly set out. That wasn't about not working with MenCap. We specifically set out a scope. around the need for an evidence base of best practice. So if you'll allow me, Chair, just to come back on that point from Phil, because I think it's really a valid point that Councillor Kirby has raised. Thank you.
Well, can I say that?
Chair, you've muted yourself.
You're muted.
How about that? I was about to say, could I ask people to mute their phones, because I'm sure I'm not the only one who can hear a dog barking in the background. Oh, it's your dog, is it?
My sincere apologies. It's a 9-month-old puppy who gets very excited at the neighbour's cat. So my apologies. I was speaking at the same time, Chair, but I will mute.
Well, I was in a meeting earlier on, and my dog, a 3-year-old Dalmatian, got up and sat next to me and started trying to lick my ears. So I know the problem, and I have sympathy. But if when you're not speaking, you could mute, and that would be helpful. So Phil, I can't see Phil here. Oh, there you are. Right. Okay. If you'd like to pick up where Hannah's asked you to.
I will, yeah, and I'll be brief, but to say, so there was 2 aspects of the scope that we've asked for an external organisation to help us on. The first is the immediate term. So this specific, the context of this specific proposal that we're talking about. So how do we shape a building-based service for the future that meets all the needs of those individuals who use those services now, and that they're fit for the future generation of people who may require a building-based service. And the second part of the scope is the much broader, as Hannah alluded to, all of the elements that we'd consider part of what we call day opportunities. So that's the links with things like routes into employment, it's the opportunities for volunteering, it's the use of ordinary community facilities, and what that means for people with a learning disability. So we've been very clear that it's an engagement, and we absolutely intend from this point forward to co-produce what that engagement looks like. We're aware that we're going to have to undertake it in very different ways, quite innovative and radical ways, given that we're in a pandemic, and much of that means remote and digital ways of working. We'll have as many and as wide-ranging conversations as we can with as many stakeholders. And just to touch on the point around using an external organisation, we have selected a nationally prominent organisation with a good, strong track record in this, and the primary reason for that is capacity. You know, the department is still working within a response to a pandemic, and so to have that support and that additional capacity that can scale this up and do it on a much larger scale in terms of engagement is really helpful at this time.
Thank you, Jennifer. I saw you.
Thank you.
Thank
you, Peter. Great, thank you. Yes, as councillor in Cannon Hill, my concern obviously is for Eastway, and I wonder if I could have some clarity to what the residents there, their new offer will be for those residents who absolutely adore the facilities at Eastway at the moment. We've heard from local residents that the facility has been redecorated recently. I don't know how true this is, but I have been told it now has a cinema and a bar, but I'm not quite sure, you know, whether that is actually something that's happened, but the redecorating has been happening there apparently. But yes, it's a very valued community hub. And the other concern also is transport, because if these facilities are lost, and you know, I hear mentioned in this business proposal about the transport. So how are people who are restricted with their mobility going to be able to access any of these other provisions? So that's a concern that I'd like a question raised upon. And also, of course, the respite for carers. If the day centres are no longer going to be available, how will these carers ever going to have any kind of respite to recharge their batteries to care for these people? So yes, a couple of questions I'd like answers to there, particularly on Eastway, please. Thank you.
Hannah, would you like to respond, or John?
Me? This place is the day centre for the people that you're aware. Prior to the pandemic, we had capacity in Eastways for 25 to 30 people per day. But actually, we only had about 8 people per day going to Eastways. And those people were really, really frail, elderly people that we were transporting on buses across the borough to the day centre for a couple of hours and then transporting them back. And Hannah and me have been to that day centre often, and people were physically exhausted when they were there. That isn't the kind of model that I want for elderly people in this borough, when there's so many things that could be done to alleviate people's loneliness and increase their interaction closer to home. So part of the proposal is that we look at all of the different options. So there's no proposal to close Eastways, to do anything. It is to look at all the different options and to look at what's best. Here we've got Mary Curtin, who runs one of the social clubs in the borough. Those social clubs, prior to the pandemic, there were over 20 social clubs in Merton. They were thriving, full of people, waiting lists to get into them. Social clubs or lunch clubs, Mary, sorry, I'm not sure in the correct title. They were thriving, full of people with waiting lists to go to them. When you went there, they were really a place that people would want to go. That is the model that I would like to see going forward, if I'm honest.
Thank you, John.
Chair, I think you're on mute.
Apologies. Shall we hear from Hannah first and then Mary?
So if I can just pick up on Councillor Gould, thank you for your comments and your questions. I just want to pick up on an important issue. So first of all, this isn't there again until the work is done and until we work with, so the piece of work we've got to do going forward is post-COVID-19. We've got to review how many people need a facility like Eastways. We have lost people. These were people that were very frail to begin with, even pre-COVID. So we need to do that piece of work with the individual users. And as John said, those numbers are low. So that piece of work needs to happen before we think of any model going forward. The second area that I just want to pick up, which I think is really, really important, especially to carers, is respite. Respite is a statutory function under the Care Act. It is based on assessed need. So that function is not going to stop if carers need respite. And remember, this isn't about closing every day centre. This is about looking at the individual need of the existing cohort of service users that attend those day centres. And if that need is there as respite, that need will have to continue to be met. So I just want to reiterate that it isn't about no daycare at all, so carers don't get a break, because we know that's really important. We also know how important it is that carers get more than a day break, so they get a weekend break, and we have good facilities where people can stay overnight to give that longer break. So I just wanted to pick up on those points. Thank you.
Thank you, Hannah. Are there any other questions about? Sorry, Jennifer, you want to come back?
Sorry, yes, I just to get the answer about the transport, because I know that's it is in the business plan. There's a mention about transport may be lost, but could anybody confirm or otherwise about that?
Hannah?
I'm happy to come back on that. Apologies, Councillor Gould, I missed that point that you raised on the transport. There's a couple of things around the transport. First of all, we've got a lot of large vehicles driving around the borough, and we need to understand that routes and the use of those vehicles. We have issued a climate emergency, so we need to think about better ways of transporting people. We've got a lot of younger people using our buses, and I'm very keen to work with those younger people and their carers around safe travel. We have great transport links in Merton. We need to be using it better, but we need to use it safely, and we need to make sure that service users who can use public transport are given the opportunity and the training to do it. So that's the first thing. Again, if somebody is physically unable to get on transport and there is an assessed need that they require transporting to that day centre or community activity that they want to attend to, then that is part of their assessment. and that is part of the duty of the Care Act to meet that need. But it doesn't mean to say that you need, you know, a lot of vehicles driving around the borough to do that. So again, it's looking at the different options we've got around direct payments, use of better, more cleaner taxi firms. It's all of that again. That's why we are at the very start of this work, and that is part of the proposal, that we work up those plans and work with people through those plans. Thank you.
Thank you. Mary, do you want to say anything about your own activities?
Right. Thank you, Chair. Thank you, Hannah. Thank you, John. It's really worrying, actually, this lockdown, where all the people are concerned. We're finding there's some mental health issues. We are visiting all our clients and sort of doing shopping for them. We're also supplying hot meals. But it's the mental side of things that is really worrying at the moment. We are keeping in touch, and we are visiting, and we are calling, and we're supplying hot food, and we're doing shopping, everything we can possibly do. But that being said, we're not allowed indoors, obviously, and we worry about they being so isolated. But I don't know what can be done about that at the moment, really. But thank you for your nice comments about fish. Thank you, Chair.
Thank you, Mary. Thomas.
Thank you, Chair. I think, as other people have suggested, it sort of just seems, and I appreciate everything Hannah and John say about, you know, this is a sort of progressed piece of work in terms of sort of it was being done pre-pandemic, and obviously it's, you know, it's no kind of immediate decision, but it just seems the wrong time to be doing something like this. I think we're both in terms of the kind of resource of the department that I think officers have already alluded to. Clearly there's a, you know, what needs to be done at the moment, and I appreciate that, you know, a review like this needs to be done over time, but you know, whether now is the right time to be doing this, both in terms of a sort of workload point of view, but also, you know, clearly as been alluded to, we are sort of talking about the sort of most needy in the community, and you know, the difficulties that will be faced both in terms of engaging with them through sort of consultations, when, you know, clearly anything will have to be done sort of virtually or not in person, at least for the sort of foreseeable future. And I think the equality impact assessment alludes to the fact that there is a lot of distress that is caused to carers and to service users when things like this are looked at. I appreciate that, as Hannah said, they are only being sort of looked at for the time being, but I think, you know, they could cause anxiety at a time when sort of clearly that would be the last thing we'd want, when we are already dealing with the sort of mental health implications of things like social isolation, and, you know, obviously clearly where users had previously relied on places like these, the idea of them not being there either sort of after the pandemic to go back to, if they haven't been going back in the meantime, or if they're sort of going to stop at some point, then clearly that will cause some anxiety. I think also at the same time there's some mention of the numbers dwindling during the sort of time of COVID. Obviously that's a difficult thing for us to assess, because, you know, it's difficult to know who of those people aren't attending because they're either following restrictions and rules at certain times, or because they just feel nervous about getting out of the house, or that they don't want to be sort of mixing with others. But as I say, clearly, you know, it's a time when we are, as Councillor Curtin said, trying to encourage people to, as best they can, sort of not be socially isolated. But clearly it's a real difficulty. I don't think Councillor Gould's question about whether the Eastway site was being renovated or redecorated, I might have missed that, but I'd sort of seen a similar comment from residents. I also thought it does seem slightly strange to, I'm sure there's good reason for it, to sort of lump in sort of Eastways with the other centres. I think from where the officers have described it, that seems very much geared up to focusing on young people. I know from the paper there is a sort of a fair spread of the people that those cover, but certainly the sort of aim of doing this piece of work does seem to be to provide more sort of flexibility and choice for the younger people that use the services. But clearly that isn't the case at Eastways, where you're looking at sort of people that are 70s plus, and as it says in the papers, often with dementia. So as I say, I think I agree with sort of everything all sort of colleagues have said, and I think sort of given there seems to be sort of unity on it, I would certainly propose that as a panel, we do recommend that sort of officers and the cabinet think again about this, and I'd be happy to formally propose that, Chair.
Okay, well, I want to give everyone the opportunity to have their say. I'm just looking around at the various images. Nigel, I believe you've spoken before. Spoken before. Can Nigel, just bear with me a minute. I'm just making sure that there's nobody else who has yet to speak that doesn't wish to speak, and then I'll start coming back to people who have already spoken. Okay, Nigel.
I wish to say I fully agree with Thomas, and I wish to second his proposal. I wish to second this, and please note names in writing, please. There is another issue I would like to bring up, is about another care centre, which is in my ward, is currently in Leighton Road, and this helpful for the disabled people, and give help support, which I fully agree and support. But please may I be mind you, even the administration, because this centre was only open about two years ago. It was moved away from the high path, because it was originally on high path, and they were forced away. They were pushed away for a new school there, and this is was rather unsettling for the people who used to use the former centre on the high path, and now they'll be are not settled again. And this is something I would like to remind you all. And there is another issue which is not mentioned in the report. There is a dementia hub centre which is in Mitcham, and through my understanding, which is in the later pages, that will be closed down in September 2021. I do not know whether this is confirmed, but I understand it will be moved to a smaller place elsewhere. Again, I find this rather worrying, because we should be out there helping the people. I do understand the knock-on effects by the COVID, but surely there are ones out there which we could see into, look into, and try and start, thinking ahead. I do know it is all up in the air, but also quite concerned about it. Thank you.
Thank you. John, would you like to respond to that point?
I'm happy to come in, Chair, in relation to some of the points that I know we've got a lot to go through, so I'll try to be brief. Councillor Barr, I think, raised a really important, is it the right time? And that is a really good question. This is one of the reasons we put the saving forward to 22-23. Remodeling services and consolidating your sites takes time. You just can't do it in a year. In some cases, it can take anything from 3 to 5 years. For that very reason, it does cause anxiety. So the level of engagement work that you do early on is really important with users and carers. And that's why we did stop in wave 1. And then we kind of had a bit of a lull in the summer. We're now in kind of wave 2. And we felt we had to pick that conversation back up because it is at the real early stages, and we didn't want to lose the work that was done pre-COVID. So I think it is a bit of a judgment call around the right time. I just wanted to pick up one other point on Eastways, and I think this shows you the commitment we have to providing day services for people. Yes, Eastways was, now I wouldn't say renovated, but if you remember, colleagues, I did come to you with my team, I think about 1.5 years ago now, when Woodlands Day Centre contract was no longer viable. And our numbers were really low in Eastway, and we came to you with a proposal of putting the two together. So we worked with the Woodland service users. That was an independent, it wasn't a council, it was an independent day centre. And with the view that we took those numbers into Eastway, because we thought we could really get the numbers up. To enable us to do that and provide a good service in a nice environment, we did invest some money in to make Eastways more accessible, but also more dementia friendly, because some of our users had started to have diagnosis of dementia. So we wanted to have an environment that could meet that need. And even pre-COVID, those numbers didn't stack up. They kept dwindling as we lost people. So, but yes, there was work done on Eastways. And just
can I ask Hannah, if did somebody mention earlier on that there was a bar installed? Can you comment on that?
Well, Councillor McCabe and Chair, if it was, they didn't tell me about it. So I think maybe a slight exaggeration, should we say, but they did make it incredibly user-friendly, and that was really important for the service users. And I just wanted to move on to Councillor Barlow, and I wanted to thank him, or sorry, Councillor Benbow, thank you for reminding us about Leighton Road, because Leighton Road is a state-of-the-art. And it is there for our service users, and it continues to be there for our service users. It was in wave 1, it was in wave 2. And again, this is not about closing all day centres. You know, we have a state of the art in Leighton Road. And if I could cover your dementia hub query as we move into the rest of the savings, that would be really helpful, Chair. Thank you.
Well, I mean, one of the things that I'd like to ask Caroline Holland is, you know, what we've heard is a number of members expressing concerns, reservations, suggesting that this is not the right time. But, you know, I think we need to remind members that the item that we're considering is the budget and business plan, and there is a gap that has been identified by our finance team. So what my question to Caroline as Director of Corporate Affairs is, if we take the view that we don't like any of these proposed savings or proposals to remodel in order to get better value for money, what are the consequences? And what are the consequences if we, as a panel or as a council, turn down all the proposed savings that are put up by officers for consideration?
Councillor McCabe, before you speak about the money, would you mind if I just mention one little thing?
I'd like to, I've asked the question, I'd like to hear the answer to that, John. Caroline, you're muted.
Yep. Thank you, Chair. On page 76 of your papers in front of you, that shows the updated budget gap as at the end of December. So before some of the settlements came through, and that showed 11.7 million gap next year. That includes the council tax assumed increase of 2%. As I've already said, 3% adult social care precept has no impact on that bottom line. Rising to 12.7, then 13.9, then coming down to 12.8 in 24-25. So any savings that you feel are not appropriate to take forward will increase that gap, and therefore certainly for 21-22 alternatives would need to be found, or we would need to take other decisions to how we can reduce that budget gap. I have to set a balanced budget for 21-22, that is the legal requirement. And indeed, there have been some concerns over local authorities, their ability to be able to keep a balanced budget this year, and indeed with the impact of that for next year. So you could be aware of our neighbouring borough, Croydon, the ability to set a balanced budget this year. They have had concerns, so therefore significant impact on them next year. And we've already seen some of the impact of some of the savings and cuts they're looking to make to have a balanced budget. So I would just draw your attention to the fact that, as I've said, with the settlement that we got on the 17th of December, it has not closed that gap. And indeed, with some of the information that's coming through with regard to our business rates, that gap, some elements of that gap is likely to increase. So it's a very difficult situation that's in front of you. And indeed, I think one of the most complex and challenging budget gaps I've ever had to deal with in my time dealing with budgets. Thank you.
Thank you, Caroline. And the responsibility of councillors in this whole process is what? Could you summarise that for us?
Well, I suppose you cannot be surcharged. I think, like you could be doing in the 1980s if you didn't set a balanced budget. But certainly proposals would be put forward to you, and if we are unlikely to set a balanced budget, I would then have to issue a Section 114 notice. That would basically mean a failure on my part in being able to bring proposals to you that you find acceptable, and your part in being able to take decisions that enables a balanced budget to be made. So there would be further papers that would come forward with proposals as to what we're going to do within that short period of time, because you only have a certain time period to be able to come back with further provisions. What could happen if there's still no agreement on a balanced budget? The government could send in commissioners and take responsibility away from you in able to represent your residents and communities.
Thank you. John, you indicated that you wanted to add something, but I wanted to get the answer to that question whilst it was fresh.
It was just a little bit about the timing. We started the engagement nearly 2 years ago. We started speaking to young people, we started speaking to carers, we started speaking to service users. We started working with them what they wanted. So we started taking them up the hill and started finding out from them what they wanted, and we started some action. Then the pandemic started and it all ended and everything came crashing down again to the start. When we started speaking to them again, they say to us, well, why have you taken so long? You've started this 2 years ago. Why now? Why are you doing it now? What's the urgency now? The urgency now is that we have to do it. We have to start engaging with them again. We have to speak to them and find out what they want for the future. The people that we've got in, I hear the word consultants being used, a consultancy agency coming in to work with them. We've engaged a national provider, an LD provider. This provider is skilled and more able than we are to engage with people with learning disabilities, people with dementias, people that are more vulnerable. We haven't got the time to do it just now. All of our officers' time has been taken up on the pandemic. The pandemic is still going on and it'll likely go on for the rest of the year. This agency will come in at a perfect time in some ways, because more people will likely engage with us just now, because a lot of people are at home. A lot of people aren't able to go out and do the things they would normally do. So this provider working with us and working with our carers over the next 6 months is actually a good time, because people will be more able and willing to speak to us than often they normally would. That was all I wanted to say.
Okay. I'm conscious that we've got two members of the cabinet with us this evening. Tobin has responsibility for matters of finance, and Rebecca for adult social care. Would either of you like to say anything at this point?
Thank you, Chair. I don't have a huge amount to add to what Hannah, John, Phil have already spoken about, other than just to echo the point that this has been sort of a long-standing process, sort of long predates me, and we have been doing a lot of work sort of at the end of last year in understanding views and engaging, particularly with people with learning disabilities. And I think I would just echo the points that Hannah and John raised, in that having those alternative options are something that have been talked about in those groups, and something that we want to be able to look at a broader offer. But I think it's really important that we come here tonight to understand the views of Scrutiny on the sort of the approach and the direction of travel. So I'm just essentially here to hear those views this evening.
Thank you. Tobin?
Chair, I don't have anything specifically to add on the financial position, which I think Caroline has covered. But what I would say in terms of the savings being considered is that certainly they were ones that I was working with Hannah and John on when I was holding this cabinet role. And probably we started looking at these 18 months to 2 years ago. And a huge amount of work had gone in, and there were lots of plans to continue that this year, and unfortunately, or last year rather, and unfortunately that wasn't able to happen because the pandemic took hold when it did. So these are not new proposals, these are proposals that were already being looked at, but I think what we've seen during the pandemic is changes to the use of some of these services, and that has probably changed slightly the nature of the review that is now being undertaken. But it is something that we were actively considering in advance of the pandemic.
Okay, thank you. Does anyone else have any questions? Linda.
Mine isn't so much a question as it was in something that John said earlier on about the times that the day centres were open, which were reduced down to 11 to 1, I think you said. Unfortunately, over the years, with the level of budget cuts we've had from government, the services have been reduced, and transport in particular has been reduced hours, and the transports were served because they had more vehicles, but those vehicles have been cut down over the time, and that's been the sadness, really. It's been a gradual erosion, really, of transport, and the cuts go on, and I've been on the council since '86, and this is diabolical right now, what we're facing, but it's been a constant reduction in service.
So, sorry, could I say something, Councillor McKay?
John, yep.
Sorry if I gave the wrong impression. It wasn't that the times have been cut down for day centres. Day centres are open from 10 till 4. But if someone is picked up at 9:30, it might mean they've got an hour in a bus to get to the day centre, or to be transported to get to the day centre. So they would get there at 10:30, 11 o'clock, and the same coming back. People start to get picked up, because if you've got a large day centre like the JMC with 30, 40, 50 people there, you've got to stagger the times that people leave. So some people will start leaving at 2, some people will leave at 3, 3:30. So it really curtails the amount of time that people have at the centres, because so much of the time is spent travelling backwards and forwards to those day centres.
Okay.
With reduced numbers of vehicles.
Nigel.
Oops.
Okay. As I mentioned earlier, and I don't think it have been addressed, is about the grants available to cover the you know, short cuts or whichever. Has the council has look into applying you know, some grants available which is aimed to help the you know, the people who are disabled or vulnerable, etc. Thank you.
Who can answer that? Hannah?
So, Chair, I'm sorry, Councillor Benbow just dipped out. I just lost connection for a minute, but my understanding was, and apologies if I've got this wrong, that it was in relation to the grant.
Yes. Has the council has ever looked into applying grants available through the government or whatever, which is aimed to help the disabled and vulnerable people. I'm sure there must be grants available. Thank you.
Hannah, did you catch that?
I did. So I think there's our grant allocation that Caroline set out around the delivery of social care and meeting our duties under the Care Act. Yes, there is other little grant pots out there, and the voluntary organisations, usually with our support, Councillor Benbow, do put bids in for that additional type monies. But they're very focused for a period of time, so there wouldn't be a recurrent service type delivery model. But the adult social care grant determination is set for us, and we get our allocation, and I'm hoping I'm picking that up right. But yes, there is other pots out there through the voluntary organisation and through charities, and I know some of our partners in the voluntary sector are very successful at accessing those additional pots of money.
Right. What were they asking for you know, to the government, like Robert generic, would he look into it and help?
Hannah?
Councillor McCabe, my apologies. My connection just is dipped in and out again. Can I ask if Councillor Benbow would put it in the chat for me? And if I can't answer in the chat, I'll answer it outside of Scrutiny, and I'll share that response with Scrutiny, if that would be acceptable, Chair. I hope you can hear me.
We can hear you. I mean, I must say, Nigel, when you started speaking, you were very faint, and I was struggling to hear you, and I turned it up to the maximum. So I think probably if you use the chat facility, that would be helpful.
Right.
Okay. Are there any other questions, comments, suggestions? Jennifer?
Yeah, I don't know whether this is another point one of the residents actually raised with me, and they've tried to get to East Ways, and they found it very difficult to get a referral, and they wondered whether the bar had been raised. So that may be the reason why there's been a drop-off, that people with dementia, this is particularly for, have not been able to access these services. I don't know if you have any comment on that. And also with COVID, isn't that part of the after effect of COVID? Aren't we going to see an increase in need and facilities for dementia sufferers? So are we looking a bit short term at this at all? You know, in the long term, are we then going to have to increase this again later and cost more money? So are we actually making a saving?
So,
sorry, Hannah.
Sorry, Chair, I came in a bit fast there. So, Councillor Gold, in relation to that specific query that was raised by a resident, if you could let me have the detail. Obviously, with the lockdown system, referrals into Eastways couldn't go ahead for the very nature we wouldn't safely be able to manage the vulnerability of over 80s in that environment. But there was no reason prior to COVID, any reason why somebody wouldn't get a referral looked at into Eastways. So again, if you share those details outside of Scrutiny, I'm quite happy to look at that specific case if that would help. I just don't want to miss that point. Or indeed, people that would have been referred to Eastways during COVID would have got either a home care visit or an outreach package. We wouldn't just not have done anything because it was COVID. So again, if you let me have those details outside, that would be helpful, so we can look into that.
Okay, and the point about the after effects of COVID, or what some people are referring to as long COVID.
So I mean, I won't comment on that, Chair. I'm not medically qualified. I think there's a lot we need to learn, and a lot more we're learning about COVID. I think apart from COVID, we know that we are an aging population. We know that dementia prevalence is high, and we know that services for dementia can be done in different ways, not just from buildings, and we'll cover some of that when we come on to the Dementia Hub. Okay.
Right, so what I'm hearing is a view of this panel that there is a feeling that the Cabinet need to think and reconsider this proposal, and I think that's a fair summary of what we've heard this evening. Is that agreed?
Agreed.
Okay.
Agreed.
So if we can move on through the rest of the proposals, Hannah, with your guidance.
Thank you, Chair. I'm going to move to 101, which is around residential provision. And
the dog's gone quiet.
Yes.
Don't be too hard on. John, do you want to step in?
I was just going to say, Chair, I'll step in if you don't mind. Well, Hannah's. I was going to say indisposed, not disposing of the dog. So 101 is titled as the direct provision review of in-house residential care. What this essentially is looking at is that we operate 2 directly provided residential settings in Meadow Suite and Riverside Drive. And again, in a similar vein to the Day Opportunities conversation, there is limited demand in terms of those settings, and therefore we're operating a higher unit cost than if we were operating those 2 services at full capacity. Alongside that is always the consideration of what is best value for money in terms of delivery of individual placements of care. So this exercise would have 3 parts to it. One is confidence and an assessment of alternative provision for individuals in either of those settings. The second would be an assessment of the 2 settings as to which was the most viable in terms of the opportunity to re-provide the individual placements for any of the residents. And then the third is a bit of wider consideration about material alternative use. And that's where some of the considerations about what is available. So Riverside Drive is a 8-bed residential unit. It's on the same land footprint as our JMC day centre, and it's operated by an independent, the building is owned and operated by an independent provider, Wandle. We provide the direct care and support in that setting. Meadow Suite is a council-owned and operated residential service, which is 6-bedded and is currently at full capacity. So those are the 3 kind of considerations. I say confidence that at the moment we have capacity within independent sector within learning disability services, There would obviously be individual consultation, review, reassessment with the individuals involved, and a careful matching and equivalent service being put into place. And that would result, the drive of the saving would be resultant from not having to staff both of those units from within direct provision.
You're on mute, Pete.
Thank you. Hannah, do you want to add anything to that? Or
yeah, I'll start by giving my sincere apologies just at the moment of speaking. I'm afraid Finn started, so apologies. No, I think Phil summed that up. There was just one point I wanted to make, which was around the unit cost for small units. So 6-bedded and 8-bedded are really high unit cost to us. So even though we're providing it, the Riverside, we're providing that service. First of all, it's residential, and the residential costs are probably a lot higher than what we could get in the independent market. That's number one. But also, again, we're seeing a lack of suitable referrals because it is a residential provision, and we probably need a little bit more high end within the independent market. So again, people are not just going into residential care, people are staying at home a lot longer, and that's really positive, but they're also using supported living in a better way. So the call for residential is probably not as high as we would have seen it, going back probably 5 years ago. But we see the need for nursing, I think, increasing. And as Phil said, we work with the market quite closely anyway because of the little provision that we've got. So it is understanding that market of what else we can get at kind of that better use of the Merton pound in terms of value for money.
Okay, are there any questions on that? Okay, well, in that case, we can move on to the next proposal. Who's going to introduce that?
So, Chair, this is in relation to the Dementia Hub, and I know again that some questions have been raised earlier on in relation to the Dementia Hub. I wanted to again just set the context, and I'm going to then invite Rich Dellis, who works very closely with our colleagues in South West London and St George's Mental Health Trust on mental health, but especially with a strong focus on dementia. And just really to set that context that this isn't about not providing dementia services within the London Borough of Merton. This is about a building and what that building is used for. The building is not a day centre. It is there as kind of advice and information from a building. But dementia services, I think it was raised earlier on, Councillor Gold raised, what do we, if we know anything at this stage about the longer effects of COVID. But aside from that, we also know we're an ageing population with a high prevalence of dementia. So there is a need and a continued need for dementia services within Merton. And this proposal going forward is looking at different ways of providing those services, that it works right across the borough and not just from one building within the borough. So I will leave it there, Chair, and to hand over to Richard, who will fill in some of the context. Thank you.
Richard?
Thank you, Chair. Thank you, Hannah. I'll just say 4 things as time marches on. So first, I think it's important to point out that the Dementia Hub is a very small part of what the council does to support people with dementia and their carers and families. The bulk of our work, especially now that social care, is meeting our statutory duty towards those people, and it is quite a few million of pounds to spend and a great deal of activity. The second thing is that the Dementia Hub service would continue in this proposal, which is not about closure of the service. It's about changing the model of service and not operating from that building. We've been wanting for some time to change the model, and we wanted to take the opportunity with the ending of the contract to change the model anyway, to move it to be more of an outreach model, and also to work more closely with memory clinics and with other parts of the voluntary sector, and to work close to where people are in community hubs, community centres, libraries, and indeed in people's homes. We would have been looking to make those changes anyway, but the necessity of making savings means that we have to look to do that at lower cost. And we've been talking to the Alzheimer's Society, the current operators of the service, about the viability, and I think there is a viable model. It's similar to what they operate in other boroughs in London. There is a process to go through. There's more work to be done on this. this is all in draft. There's formal consultation to go through, and we would have to procure the alternative service. So there's a little bit of a way to go. I think it's important to say that the Dementia Hub service would continue. It would just operate differently. I think for a lot of people, it will be more accessible because it will be nearer to them. That's what I was going to say, Chair.
Thank you. Are there any questions on that? Any comments? Okay. Jennifer.
Only to say that how important it is for dementia sufferers to continue socialising. It's vital for them to be able to get out into the community. So I'm pleased to hear that that would still be happening, but in different venues. Thank you.
Okay. I think we all accept the need for such services. So where do we go from here, Hannah? What do you want us to look at and consider next?
So I think I've brought you to those three savings. I think you've obviously raised some questions. There's been some asks of us. I know we need to look at some figures in relation to the overall percentages, I think, on CH 100. And then we, again, these are draft EIAs. As we move through this process, we will continue to develop those EIAs. We will continue to monitor the impact. That's really, really important. And we would want to continue the level of engagement we want to do now, even though that's a bit of a challenge because it is COVID-19 and some of this engagement we have to do in different ways by Zoom. But we also know that our residents and carers who use these services have got very good at using technology to collaborate with us. So I think our approach would be we continue slow and steady. We said these are proposals. We've been looking at it for a long time. We've put a lot of work into this over a year and a half ago. And I think we wouldn't want to lose that level of work or engagement that we've done. But it is very early stages in the process. And we also, as raised by colleagues tonight, as we move towards this process and move in a world that either lives with COVID or starts to move out of COVID, we will also learn the impact more of COVID, and that may well change the different types of options that we will consider to put forward for eventually for consultation.
Okay, so does everyone feel that they've had an opportunity to have their say on this agenda item? Okay, Caroline, you want the last word?
No, well, Chair, I just didn't want you to miss out on anything. So I did want to draw your attention to the capital programme,
Right.
page 80. And then
we want to talk us through that?
So there are some schemes there which link with the Sustainable Communities panel. So you've got some telehealth care, capital costs, and the learning disability affordable housing. So I just wanted to...
Sorry, what page did you say this was on, Caroline?
80.
80.
80 of the agenda tonight, not the information pack.
Yep.
So I just wanted to draw your attention to some capital schemes that are there for you.
Very small print.
Well, it's smaller in the information pack because there are also revised service plans,
right.
Starting on page 123 for this panel. If there's any comments that panel members had as well for that.
Okay, well, shall we deal with the capital programme on page 80 first? Are there any questions or comments on the information there? Okay, so the next page you're referring us to, Caroline, is where?
Page 123 of the information pack.
Right. 1, 2, 3.
Yeah.
Okay. Do you want to say anything about any of this? Again, it's very small print.
So there are 5 service plans that are of particular relevance to this panel: adult social care commissioning, direct provision, learning disabilities, operational, and public health. So it's just if the people had any comments on that to feed those back, because again, these are draft and will be coming back to Cabinet on the 22nd of February and on to Council then on the 3rd of March.
Okay. Are there any questions? Or are there any comments? No? Okay. So, is there anything else, Caroline?
I suppose it was just depending on what you're going to do next. If you're asking Cabinet to reconsider these, it would be good to know if you have a view on what alternatives could be put forward to offset the gap. So it's just if you have any thoughts on that. Thank you, Chair.
Well, I think colleagues need to understand that given the size of the gap, saying we don't like this and we don't like that and we don't like the other isn't going to take us very far. We do need to hear from you what your alternatives are. And of course, one of the things that officers will have been doing in the run-up to this whole process would have been considering alternatives and reaching conclusions that these were the least worst options. But are there any other suggestions that members of this panel do have at this stage? No. It's a lot easier to do the other, isn't it? Okay. Well, I'm Caroline. I'm afraid the panel have made their comments about what's ahead of them, but haven't been able to come up with alternatives. But perhaps they may reflect on this conversation, and if they do come up with some extraordinary ideas or suggestions that will prevent you from having to progress these proposals, then I'm sure you'd be delighted to hear from them.
Absolutely, yes, Chair.
Okay, so have we completed item, I'm swapping between all these papers, item 4 at this stage? Yes? Okay. Well, in that case, can we move on to item 6, which is the impact of COVID-19, a verbal update from John.
And just before John starts, Chair, if I may take my leave of you, please. Thank you.
Okay. Thank you for attending, for staying so late, and for answering all our questions.
That's fine.
No doubt we'll be discussing this again in the future.
Certainly will, Chair. Thank you.
Thank you. Thanks,
Good
Caroline.
evening.
Chair, sorry to interrupt. Can I say that I've received apologies from Councillor Chung. He had a last-minute emergency, and we have Councillor Henry here as a substitute.
Well, this is a kind of it's one of those substitutions that are made as the game is reaching its finale, and sometimes a late substitute has a tremendous impact on the game. So, Joan, we're delighted to see you. We've had quite a good discussion already, and we're grateful to you for filling in for David. I understand he has had an issue involving the health of his wife, so we'll certainly understand why he's had to change his plans at such short notice. Okay, so John, do you want to give us the verbal update, please?
So I'm just going to give you a verbal update on our work around hospital discharges and on shielding the clinically extremely vulnerable, as I was requested the last time. And if it's okay with you, Chair, Phil Howell at the end would like to ride in on his white horse and discuss our work on vaccines. And it give you a verbal update on some of the work on vaccines, which might be good at the end of what I speak about. So Dagmar's already taken you through the very bleak slides on hospital admissions just now. She did it earlier on, so I'm not going to take you through all of that. I'm just going to tell you a little bit about my key role just now in ensuring that we discharge people safely and appropriately from hospital, and that we've got the capacity to do that to get people back to their own homes and out of hospital when we're ready. So as you're aware, and as Dagmar's already told you, there's been a huge surge in recent weeks and days in our hospitals, which is threatening to overwhelm some of our hospitals in the capital and across the UK. As Dagmar's told you, and as you've seen in the press and the news, NHS is facing significant pressure at this time. But it's not just the NHS, the entire system, including social care, is also under huge pressure to meet the demand at a time when we are seeing more staff catching COVID and not being able to work. So across the system, we've got a reduced workforce because people are off with COVID, plus we've got an increase in work across the whole system. The Mayor, as you all know, the Mayor of London declared a major incident in London on Friday, saying hospitals in the city are at risk of being overwhelmed, and again, asking people to stay at home and limit contacts with people to protect themselves in the NHS. My role in the role of adults at this time is to work with our partners across the system to ensure that people are medically fit to be discharged and who need support in the community get the support to enable them to be discharged safely, freeing up the capacity in the hospital, so freeing up beds and capacity for people that need to be admitted. When I last came to Scrutiny, I updated you on the surge planning we've been doing, working with our partners in health, regarding the numbers of people that we would be expected to be admitted and discharged from the start of the second surge of the pandemic to the peak and onwards. As you know, we're in that second surge now. We are well into it and we're very close to the peak of the pandemic. We've got, the last time I came, I discussed the different pathways with you around pathway 0, 1, 2, 3, and 4. And I won't take you through that again, but that was the detailed numbers that we put in place for this planning. At the moment, I just wanted to let you know that we are managing with our discharges. It's a difficult time for everyone, but at present, our plans are working well. We have the capacity in the system, and we are being able to discharge the people that are ready to be discharged as is needed. We are now at the peak this week or next week, and at the moment, we have capacity. We're working hard on that, maintaining that. We've got daily meetings with our hospitals, with our acute hospitals, discussing patients. We're looking at our capacity, our workforce capacity, and our home care and nursing residential capacity on a daily basis to ensure that we've got capacity. But it isn't easy because there's a lot of pressure here. I also just wanted to update you on shielding. As you're aware, shielding was reintroduced on the 20th of December for people that are clinically extremely vulnerable. I'll call them CEVs as I did the last time. For the areas entering tier 4, sorry, which of course London did on the 20th of December. That's been extended again on the 5th of January up until the 21st of February at this time. CEVs are asked to stay at home as much as possible to protect themselves in the NHS. This is the third time that shielding has been introduced. We had the structures and the systems in place to manage this. We currently have about 6,500 people shielding in Merton, classed as CEV. The last time we had about 7,200, so the numbers have altered slightly. And as you're aware, we commissioned the Community Hub to support CEVs and Merton residents during this time. The Hub receives on average of 70 calls a day, but that sometimes goes up to 120 if we've got more communications with them. The Hub are able to support our CEVs and residents in a number of ways. They've got direct access to the pathways into the GPs. So if someone's got a medical need that doesn't need 1-1 or the hospital, we're able to signpost them through the GP, through social prescribing. We're also able to assist people that need medication through the pharmacist or again through the GPs if needed. We're able to support people with priority slots for people that are CEVs to get priority slots at supermarkets, or of course get emergency food packages through our food banks if members of the public or CEVs need emergency food packages. We're also able to give support around shopping, well-being, signposting people into the voluntary sector to alleviate loneliness, give people benefit advice, and help maximising people's income through the voluntary the voluntary sector as well. We also keep in regular touch with our people that are the CEVs. We write, we text regularly, and there's a smaller group of the 6,500 where we actively phone them. We undertake socially distanced with PPE visits to some of the more vulnerable people on the group to give them as much support as we can as well. That was all I wanted to update before it came across to Phil around vaccines.
Thank you, John. And Phil, you know, we've already. What's happening? Can you still hear me?
We can. I think, Stella, if the intention was to bring the slides up, I think we'll probably not bring the slides up at this point.
That completely threw me. I thought I was going to. I was about to say that, having heard from Hannah's dog, we were about to see your white horse. Do you keep it at home, or where is it stabled? But I mean, John did mention this horse, and you know, I think if we're going to have some livestock, let's really go for it tonight.
So I think hopefully it was a useful metaphor that we're told that the vaccine is our hope on the horizon. It is our cavalry on the white horse. I don't keep a white horse myself. Chair, I circulate, or Stella on my behalf circulated a set of slides earlier today. Just an apology that they did come late, but also that I wanted to make sure they were as an up-to-date position as they could be. And equally, it's almost Tuesday, and with the publication of the national vaccination programme rollout this afternoon, some of that information will move on very quickly. So I don't propose that I take you through the set of slides. I'm very happy outside the meeting to answer any further queries on the programme. Just the key points I would make and reiterate from the slides is that this is, as you're well aware, an NHS-led national programme of rollout. Our key vaccination routes at the moment are predominantly through primary care, through the hospital hubs as places that can safely vaccinate using the Pfizer vaccine, predominantly because of the cold storage. But as the weeks roll on through January and February, you'll see things like the community roving teams and mass vaccination sites start to come on board. Now the supply of the 3 approved vaccines is really starting to come through on the ground. The stated intention, again, nationally, as you're well aware of, is to work through the top 4 priority cohorts from the Joint Committee on Vaccinations priority list by the 15th of February. And by the end of the month, the intention is to focus on the very top 2 groups, which is care home staff and their residents, and the over 80s. So it is moving at pace. The Wilson and the Nelson primary care sites are our 2 main primary care routes, and they cover all of the GP practices in Merton. So the headline information, I think, to reiterate, if there were any queries from anxious residents in particular, is that within the age priorities, it's absolutely the case that the NHS will be contacting people directly, and that again will start, more people will be contacted more quickly over the next couple of weeks. We've got plans in place for all of our internal frontline social care workforce and the wider workforce that works in direct contact with vulnerable people, as well as all of our externally commissioned provision. Care home staff were the first to express interest starting back in the middle of December, and then moving through domiciliary care workers towards Christmas and carrying on through the Christmas and New Year period. And the bit to point out is that as things ramp up and it comes on stream, the data will be more readily available. So again, as things are updated, the CCG engagement team is committed to providing regular updates, because I know councillors will be particularly interested in terms of how quickly Merton specifically is moving through those priority groups and how far we are into the vaccination programme. I'll pause there and say happy to answer any questions that I can at this stage.
Thank you, Phil. Are there any questions? Mary.
Thank you. If I could just go back to John and ask him about wearing masks, and is there any plans to mandate masks in public when you're out in public? Because we can still go into supermarkets if we go now, but when you do go, there's very few people wearing masks. And that's always been a bit of a bugbear with me because, you know, in my opinion, it's one of the safest ways to protect each other. So I'd like to see, John, if there's any news on mandating masks. Thank you.
I haven't been used specifically, but I think it's a really good point that you've raised. Because we go around public transport, supermarkets, more people are without masks. I think the mood in the country is changing. I saw today that Borough Market is the first place in London to mandate that people must wear masks. I saw one of the other supermarkets today also, I can't remember which one it was, saying that they will now police it and people must wear masks when they come into the supermarkets. So I think that the mood in the country is slightly changing, and I hope it does, Mary, because it is a good point you've raised.
Thank you.
Any other questions, comments, contributions? Okay, well, in that case, I'd like to thank John and Phil for their update. And we'll move on to item 7, which is the work programme. Can we note the work programme?
Yep, noted.
Okay, well, in that case, can I thank you very much for your contributions to this meeting and your questions to the officers. Mary, do you want to say something?
If I could put a request in, Chair, would you mind? It's a request for anybody who's got an old laptop computer, if they'd be willing to donate it to Friends in St. Helier.
Right.
If no longer used. Thank you.
I'm not sure that was on the agenda, but you managed to get it in, so I take my hat off to you. And I will now declare the meeting closed before somebody else asks for an item of furniture to be delivered down the road to their neighbour. Okay, thank you. And we'll please do keep safe. And if you do see somebody without a mask going into the supermarket, ask to see the manager and say, why are these people in here? Good night. Thank you for your time.